Let's discuss the 5 transporting points. LI11, QUCHI, pull at the crook. Location with the elbow flex on the lateral end of the elbow crease in a depression between the end of the crease and the lateral epicondyle of the humerus on the extensor carpi radialis longus muscle. How to find? First, with the elbow completely flexed, locate the lateral end of the elbow crease. Next, with the elbow flexed at approximately 90 degrees, palpate for a pressure-sensitive depression in this area on the extensor carpi radialis longus muscle. LI11 is located close to the border of the proximal aspect of the ulna. Also located at the level of the elbow crease are lung 5, P3, radial ulnar of the tendon of the biceps, and heart 3 with the elbow completely flexed at the medial end of the cubital crease. Needling vertically 1 to 1.5 tune. Actions, indications, clears heat, expels wind, clears yang min fire, cools the blood, drains dampness, alleviates itching, opens the channel. Special features, Husi point, earth point, tonification point, Sun Si Miao ghost point, Madanyang heavenly star point, important point for heat conditions and disorders of the upper extremity. Very important point for the skin diseases, both from blood heat and damp heat. Important point to clear heat in general. Frequently used for channel and joint problems of the arm in painful obstruction syndrome, B syndrome, sequelae of windstroke, and atrophy Wei syndrome. Yang min or yang brightness channel is considered to be particularly replete with yang qi, and points of the large intestine channel are among the most important points to clear excess of yang in the form of heat. LI11 is the principal point on the channel and indeed one of the foremost points on the body to clear heat and fire. It is used in all cases of fever due to excess heat when pathogenic factors have penetrated to the yang min or qi levels and chills are no longer present. In this respect, it may be compared to LI4, which is mainly used when the pathogenic factors are still on the exterior in the form of wind cold or wind heat. When the fever is moderate and when chills are still present. In clinical practice, both points are commonly used together to control many different kinds of fever. Like LI4 and other points of the large intestine channel, LI11 is also used to clear heat from the yang min channel in the head, whether it affects the throat, eyes, or teeth, and it is indicated for swelling and pain of the throat, redness and pain of the eyes, lacrimation, and toothache. Like LI5, it is also to clear yang min fire, which transmit to the heart and spirit, and it is indicated for agitation and oppression of the chest, mania disorder, and tongue thrusting. For this reason, under its alternative name of ghost leg, LI11 was included by ZANZHU Miao among his 13 ghost points for the treatment of mania disorder and epilepsy. Earth point, tonification point, Husi point, antique autumn point, ghost point, Aman Danyang heavenly star point, mental precision point. This valuable tonification point can strongly invigorate the meridian, can be considered for problems in the face, example, eye disorders, especially when accompanied by extreme redness and pain, earache, toothache, along with LI4 and LI7, bronchitis, and high fever. This point may be effective in cases of chronic constipation. Excellent for bringing stability to the LI. It's the earth point. Consider this point before releasing the internal dragons. If a degree of possession is suspected, it is a ghost point. For problems of the shoulder, upper arm, and forearm. CROOK point cools blood heat and can be used when there is heat in the blood affecting the skin, as in some types of psoriasis. LI11 is frequently combined with LI4 and DO14 in acute fever and situations of fire poison, boils, and throat swelling with heat. It can help clear interior heat from any organ. Being a HUSI point, it allows qi to drain from the meridians into the organs. HUSI points can be used to supplement, tonify, or drain and disperse qi. Expels exterior wind and is often used in later stages of wind heat. Resolves dampness and is useful for resolving damp heat. Used for masses in the back and upper body. Used for thyroid goiter, considered a form of phlegm. Benefits the sinews and joints. HUSI points are used to smooth the flow of qi and blood in the meridian, as well as dislodge pain and pathogens in the joints, and so are good for joint pain. Thank you for your attention.
Now let's discuss Bladder 2, ZANZHU, gathered bamboo, a point of the eye system. Bladder 2 is located in a depression at the medial end of the eyebrow, directly above the inner canthus of the eye. How to find? As the location of the eyebrow can vary, the medial canthus of the eye should be used for reference. Bladder 1. Palpate for a generally pressure-sensitive depression in this area of the orbital ridge. Caution. According to Sabota, except in rare cases, Bladder 2 is not located on the supraorbital foramen, mainly located more laterally, but in the area where the supratrochlear artery and the supraorbital nerve emerge, frontal notch. Bladder 1 is located inferior to Bladder 2. Needling, 0.3 to 0.5 soon obliquely from lateral to medial or transversely, subcutaneously in the direction of the disorder. Caution, branches of the frontal nerve, facial nerve, blood vessels. According to the majority of authors, moxibustion is contraindicated, considered a less risky alternative to Bladder 1. Actions, indications. Benefits the eyes, expels external pathogenic factors such as wind, clears heat, clears the head, moves qi in the bladder divergent channel, for example, for painful hemorrhoids. Special features, important and frequently used local point for the eye region. Good point for excess and heat syndromes of the eye region. Prick to bleed, puncture the point and let it bleed, but avoid facial hematoma. So Bladder 2 expels wind for redness, swelling, and pain of the eye, itching of the eyes, epilepsy, twitching of eyelids, excessive lacrimation, hemorrhoid pain. Clears heat, brightens the eyes, blurred vision, dizziness, diminished night vision, eye nebula. Subdues liver qi for headache, dizziness, pain in the eyebrow, nosebleed, facial pain, cheek pain. This is an important local point for the eye. First of all, it expels exterior wind from the face and removes obstructions from the channel. This means that it can be used to treat facial paralysis, facial tics, and trigeminal neuralgia, all problems caused by wind affecting the channels of the face. Bladder 2 brightens the eyes and subdues liver qi, but only locally in relation to the liver function of nourishing the eyes and in relation to headaches. It can therefore be used in any liver pattern affecting the eyes, such as floaters in the eyes, red eyes, blurred vision, and persistent headaches around or behind the eyes. Bladder 2 is an important and frequently used local point for the treatment of disorders of the eye and the surrounding region. It may be substituted for Bladder 1 in a variety of eye disorders, primarily those due to attack by exterior pathogenic factors, especially by practitioners with insufficient clinical experience in needling points close to the eyeball. For this purpose, it may be needled to join with Bladder 1, or in the case of heat patterns, pricked to bleed. Its effect on redness and itching of the eyes, combined with its ability to treat rhinitis and sneezing, renders it particularly suitable in the treatment of hay fever. The sphere of action of Bladder 2 is not confined to the treatment of eye disorders, however, and it is frequently used as a local point for frontal headache, pain of the eyebrow region, sinus pain, and facial paralysis, and more widely for one-sided or generalized head wind and headache following alcohol intoxication. The bladder divergent channel winds around the anus, and bladder 2 is indicated for pain of hemorrhoids, an illustration of the principle of using points above to treat disorders. This point refreshes our physical and mental faculties, can be considered as an alternative to or supplement for bladder 1. For sinusitis, hay fever, or eye problems, clears the nose and head, consider for headaches, particularly around the eyes. The eyebrow resembles a bamboo leaf, hence its name. Local point for eye problems, pain and congestion of the surrounding area, benefits the eye and is used for blurred vision, tearing, redness, pain in the eyes. It is used particularly in hay fever to alleviate redness and itching. Bladder 2 is often used with LI20 for stock sinus problems. Benefits the eye, opens and brightens the eye, expels wind and cold, clears heat, eases pain, clears the nose and head, strengthens the back, soothes the liver. Thank you for your attention.
Let's discuss the extra point, Shixuan 10 diffusion EX upper extremity 11 and Shiqizhui below the 7th vertebra EXB8. Location on the tip of the 10 fingers. How to find? These 10 points are located on the tips of the 10 fingers, approximately 0.1 tune from the free margin of the fingernails. Located in a comparable position on the foot are the points of EX lower extremity 12 on the tips of the 10 toes. Needling, prick to bleed. Actions indications, expels pathogenic factors. Needling, prick to bleed. This may be followed by moxibustion. Actions, open the portals and revives consciousness, drains heat, and pacifies wind. Indications, loss of consciousness, wind stroke, summer heat stroke, febrile disease, swelling, and pain of the throat, acute childhood fright wind, clonic spasm, epilepsy, mania, vomiting, diarrhea, numbness, or pain of the fingers. The points were first discussed in the 1,000 ducat formulas by the great 7th century physician Sun Si Miao. They are almost exclusively used for acute conditions such as loss of consciousness, including the acute phase of wind stroke, epilepsy, heat stroke, sunstroke, etc. They are usually pricked to bleed, a procedure which may occasionally be followed by moxibustion. EXB8 below the 7th vertebra, location on the midline below the spinous process of the 5th lumbar vertebra L5. How to find, locate the tough ears line L4, next palpate in an inferior direction to the next vertebra L5 and locate EXB8 below the border of its spinous process at the lumbosacral joint. Located on the same level are a point of EXB2, bladder 26.5, 1.5 tune lateral to the midline. Needling 0.5 to 1 tune vertically to the skin or obliquely in an inferior direction. The patient's back should be straight or slightly flexed to avoid a spinal puncture. Oblique insertions in a superior direction should only be carried out by experienced practitioners, as in small persons, regardless of their weight, the spinal canal can be reached after only 1.25 tune. Caution, in pregnant women about to go into labor, this point have a labor-promoting effect. Actions indications, tonifies the kidneys, opens the channel locally. Location notes, slide a finger upward along the midline of the sacrum until it meets the significant depression inferior to the lumbar spine. Needling, perpendicular insertion 0.5 to 1 tune. Caution, the spinal canal lies between 1.25 and 1.75 tune deep to the skin surface, varying according to body build. Actions, tonifies the kidneys and promotes urination, activates the channel and alleviates pain. Indications: pain of the lumbar region and legs, difficult urination, fetus pressing on the bladder. MBW25 was first mentioned in the supplement to the 1,000 ducat formulas. It is among the most commonly used points for chronic back pain and is very often found to be the focus of tenderness. It may be used in both deficiency and excess patterns and in the frequently encountered clinical situation where the two are found in combination. Combinations: chronic lumbar pain, MBW25, bladder 26, bladder 53, bladder 40. Thank you for your attention.
Let's discuss bladder 40, Wei Tsung, middle of the crook, a Hulsey point. Bladder 40 is located in the center of the popliteal crease between the tendons of the biceps femoris and semitendinosus muscles. How to find? This point is best located with the patient's knee slightly flexed. Locate the center of the popliteal crease. A pulse may be palpable, and there locate bladder 40. Located on the same level are bladder 39, 1 Tsung laterally, kidney 10 more medially between the tendons of the semimembranosus and semitendinosus muscles, and liver 8 more medially anterior to the tendons of the semimembranosus and semitendinosus muscles. Needling vertically 0.5 to 1.5 Tsung. Caution: popliteal nerve, artery, and vein lie deep to this point. Use moxibustion with caution, contraindicated according to some authors, to clear heat and eliminate stasis. Bleed the superficial veins, possibly followed by brief cupping. Caution: only used for excess conditions and in constitutionally robust patients. Bladder 40 is also indicated as a distal point for the lower back. Needle with the patient standing for safety and balance. Use a treatment couch or chair as a support for the hands and ask them to move their lower back gently while manipulating the needle. Only short needle retention. When needling this point with the patient in a prone position, place a supporting roll or pillow under the ankles to relax the popliteal crease. Actions: indications of bladder 40. Clears summer heat, stops vomiting and diarrhea, cools the blood, benefits the lower back and knees, opens the channel and luo vessels, alleviates pain. Special features: Hulsey point, earth point, lower Hulsey point of the bladder, Madanyang heavenly star point, Ka-Wu command point of the lumbar region. Important distal point for the lower back, point with a wide range of indications. Clears heat and cools blood, removes obstructions from the channel, lower back ache, sciatica, stiffness of the lower back, knee pain. Clears summer heat, injury by summer heat, fever, aversion to cold, sweating, headache, a feeling of heaviness, an uncomfortable sensation in the epigastrium, irritability, and thirst. Bladder 40 is the Hulsey point of the bladder channel and has long been considered one of the most important of the acupuncture points. According to Madanyang, the great physician of the Jin dynasty, bladder 40 is one of the 11 heavenly star points, indicated for lumbar pain with inability to straighten up, severe lumbar pain that radiates up the back with pain and stiffness of the sinews and bones, wind painful obstruction that frequently recurs, and difficulty in stretching and bending the knee. The Ming Dynasty author Ka-Wu, in the glorious anthology of acupuncture and moxibustion, included it among his 4 command points, with a special action in the treatment of lumbar pain. Sun Si Miao, in the 1,000 ducat formula, says of bladder 40, pain of the lumbar region and spine that almost reaches the head. In any case of heaviness and pain of the lumbar region and leg, bleed this point. Earth point, Hulsey antique autumn point, lower Hulsey point of the bladder, greater assembly point of the back and vertebrae, a Madanyang heavenly star point, accumulation point of blood. This important point can bring stability and equilibrium to an anxious, disorientated, or fearful person. It is effective for controlling the blood along with bladder 43 or bladder 38. Can have a direct effect on the spine as a whole along with bladder 60 and is helpful after osteopathic manipulations. Can either free rigidity in the spine, sedate, or tighten it up to tonify. for urinary troubles and night sweats. For disorders due to poor circulation, for example, hemorrhoids. Consider for knee problems, lower backache, urticaria, arthritic knees, swollen feet, or loss of head hair. Great balancer of fluids. A major acupuncture point. Equilibrium middle describes the effect of this point on the mind and spirit. When fear is scattering and disorientating the person, showing as nervousness, anxiety, and inability to settle, the steadier, deeper energy of the Husi point, together with the centering and harmonizing effect of earth, helps the person contain and compose themselves and gather their thoughts and senses. Earth within the water brings stability. As a yang Husi point on the lower limb, it has an influence on its associated fu, the bladder. Because Husi points are situated where the command points end, they are seen as being a transitional state where external pathogens might enter more deeply into the body. Husi points present an opportunity if pathogens have entered this far to dislodge and expel them. They are indicated for diseases of the skin from pathogenic invasion because they are the most proximal of the transporting points. They affect the center of the body more than the far reaches of their meridian, which is affected by more distal points like the Jingwell points. The energy of Husi points is slower, deeper, and more stable than that of more distal points. Husi points can be used to supplement or tonify qi as well. Bladder 40 is able to clear heat and resolve damp from the bladder. It is applicable in a range of urinary problems, painful urination, cloudy urine, blood in the urine. This point also clears heat from the blood and moves obstructions from the meridian, and so is used for stasis of blood in the legs. It clears summer heat, and so is used when someone has suffered an acute attack of heat leading to delirium, rash, or fever. As a Husi point affecting the middle of the body and a point which moves qi and thus eases pain in the bladder meridian, it is a frequently used point for low backache, chronic or acute, although more frequently used in acute cases and when the ache is on one or both sides of the spine rather than on the spine. As a local point, it is a useful point for many disorders. It relaxes the sinews, benefits joints, and removes obstructions from the bladder meridian. Thank you for your attention.
Let's discuss the small intestine channel, primary channel. Pathway. The external pathway of the small intestine primary channel begins on the little finger on the ulnar corner of the nail at SI1. This point is reached by a branch that separates from the heart primary channel at heart 9. Hand yin-yang connection to the second great circuit. The channel runs along the ulnar border of the hand, passes the wrist, and continues along the ulna to the medial aspect of the elbow. Passes between the olecranon and medial epicondyle, ascends the posterior aspect of the humerus to the shoulder joint, and according to some authors, meets LI14. Zigzag across the scapula, passes bladder 41 and bladder 11 and meets the extraordinary vessel Dumai and other young primary channel at Du14, below the spinous process of C7. Continues anteriorly to the supraclavicular fossa to stomach 12. An internal branch originates at stomach 12 and runs inferiorly to the heart. The paired sung organ continues to REN17 and descends along the esophagus, penetrates the diaphragm, and continues to the stomach, where it crosses REN13. And REN12 further descends and spreads in its pertaining organ, the small intestine. According to the Neijing Ling Shu, an internal branch courses from the small intestine, according to some authors, from the small intestine primary channel to stomach 39, the lower Husi point of the small intestine. The external pathway of the small intestine primary channel continues from the supraclavicular fossa along the neck and ascends to the cheek to SI18. From SI18, a branch courses to bladder 1 at the inner canthus of the eye, where it connects with the bladder primary channel, 6-channel Churi, yang axis Taiyang. A further branch travels to the outer canthus of the eye, intersects with Gallbladder 1, according to some authors, also with tripod burner 20 and GB11. Continues to TB22, anterior to the ear, and terminates anterior to the ear deep to SI19. Clinical importance, exterior signs and symptoms, mouth and tongue ulcers, cheek pain, neck pain, occipital stiffness, pain on the lateral aspect of the shoulder and upper arm. Interior or ZANZHU organ signs and symptoms, pain and distension of the upper abdomen radiating to the genital region, diarrhea, epigastric pain with constipation. Connections of the small intestine primary channel, connections with other channel. Heart primary channel, connections. Hand yin-yang connection to the second great circuit. Location, heart 9, SI1 on the hand. Circulation, circadian, according to the organ clock. Importance, exterior-interior relationship. Bladder primary channel connection paired according to the 6-channel Curie hand-foot pairing. Taiyang yang axis of the second great circuit. Location, SI18, bladder 1 on the head. Circulation, circadian according to the organ clock. Importance, above-below relationship. Connections with other ZANZHU organ system, heart, stomach, small intestine. Thank you for your attention.
Now let's discuss the heavenly star points of Madanyang, Gallbladder 30, 1 Tiao, and Gallbladder 34, Yang Ling Chuan. GB30 is located with the patient lying on their side at the junction between the medial 2/3 and the lateral third of a line connecting the greater trochanter and the sacral hiatus. How to find? Patient's position. Supine or better lying on their side, preferably with the hip and knee joints of the side to be needled, flexed, and the lower leg straight. Use pillows for a comfortable position. Reference points: the sacral hiatus and the lateral prominence of the greater trochanter. GB30 is located on the line connecting these 2 points, 1/3 of the distance from the greater trochanter. Needling 1.5 to 3 tune vertically towards the genital region. The needle may reach the fascia of the obturator internus muscle as well as intermuscular connective tissue. Long 3-tune needles should be used. Caution: needling is often painful. Needling can result in an electric touchy sensation radiating to the toes. This sensation is particularly common with sciatic disorders, and if GB30 is needled, 1 tune inferior to its normal location. Actions, indications: opens the channel and the luo connecting vessels, alleviates pain, benefits the hip and legs, eliminates wind dump. Special features: meeting point with the bladder channel, Madanyang heavenly star point, important point for disorders of the hips. Removes obstructions from the channel for hip pain, pain in the buttocks, pain in the lateral side of the leg, sciatica, hemiplegia, atrophy of leg, numbness of leg, rigidity of knee. Resolves dampness and expels wind, urticaria, eczema, tonifies chi and blood, tiredness, poor appetite, loose stools, blurred vision. Can be used for damping in the anus, urethra, and vagina. GB30 was included by Madanyang, the great physician of the Qin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for cold wind and damp painful obstruction, pain radiating from the hip to the calf, sighing with pain when turning over. GB30 is unrivaled in importance for the treatment of disorders of the hip joint and buttock, whether due to traumatic injury, painful obstruction, stagnation of qi, or deficiency. Crossing point of gallbladder and bladder, a Madanyang heavenly star point, one of the 9 needles for returning yang. For all disorders of the hip, consider needle or moxa. For sciatic pain, down gallbladder or bladder meridians. Consider for lower back pain and groin pain. Helps a person's mobility. They can jump once again. The crossing of the bladder and gallbladder meridians at this point make it suitable for sciatica from whatever cause, and it is one of the most frequently used points for this. This reunion with the bladder meridian which traverses the lumbar area here, also makes this a useful point to affect the lower back, as well as the lateral aspects of the body, which come into the energetic territory of the gallbladder. The usefulness of this point is reflected in the fact that Madan Yang lists it as one of his 12 points shining bright as the starry sky. Now let's discuss Yang Ling Chuan, GB34. Location in the depression anterior and inferior to the head of the fibula between the peroneus longus and extensor digitorum longus muscles. How to find? This point is best located with the patient's knee flexed. Use knee support. Palpate for the head of the fibula on the lateral aspect of the leg and hold it with the index and middle fingers in a tweezer-like way. Gliding distally with both fingers, the more medial finger will drop into a depression directly anterior and inferior to the head of the fibula, the location of GB34. Located on the same level but on the medial aspect of the lower leg is spleen 9, at the junction of the shaft and the medial condyle of the tibia. Needling 1 to 1.5 zone vertical insertion between the tibia and fibula towards the interosseous membrane. Caution, deep peroneal nerve with deep needling. In some cases, also common peroneal nerve. The needle may reach the interosseous membrane as well as the epineural tissue of the peroneal nerve. Actions, indications, benefits the tendons and joints, opens the channel, alleviates pain, benefits the lateral costal region, clears damp heat from the liver and gallbladder, spreads liver qi. Special features, Husi point, earth point, Hui meeting point of the tendons, coordination movement, lower Husi point of the gallbladder, Madan Yang heavenly star point, major point for disorders of the tendons and musculature. Promotes the smooth flow of liver qi, so for hypochondrial, epigastric, and abdominal distension, irritability, moodiness, depression, sighing. Resolves damp heat in the liver and gallbladder, so for bitter taste, hypochondrial fullness, inability to digest fats, feeling of heaviness. Benefits the sinews, for contracture of sinews, stiff neck and shoulders, pain in the elbow, hip pain, sciatica. Removes obstruction from the channel, pain in the calf muscles, painful obstruction syndrome, and atrophy syndrome of the lower leg, swelling, pain, and redness of the knee, rigidity of knee, cold painful obstruction syndrome of the knee. The importance of GB34 in disorders of the lower leg as a whole is further emphasized by its inclusion in Madan Yang's 11 heavenly star points, his grouping of the most vital acupuncture points. According to this great physician of the Qin dynasty, GB34 was indicated for swelling and numbness of the knee, cold painful obstruction, hemiplegia, and inability to raise the leg. The action of GB34 is not confined to the lower limb, however, and it may be used in the treatment of stiffness of the neck and shoulders and pain of the sinews in the elbow, for example, tennis elbow. In summary, GB34 may be used for pain, cramping, contraction, stiffness, and sprain of the sinews and muscles in any part of the body. GB34 is an earth point, Husi antique autumn point, lower Husi point of the gallbladder, influential point for the muscles and tendons or sinews, quiet courage point. This important point regulates the earth within the wood, and as such brings strength and flexibility. It is a special point for the muscles and tendons. Consider for every type of knee and foot problem. Excellent for improving articulation of the knee. Consider if the lower limbs are in spasm or are cold or numb. For mental disorders such as depression, irritability, anger, confusion, or emotional extremes. It is helpful for timidity and poor decision-making, or when the patient sighs a lot. For lack of coordination between body-mind, left, right, up, down. It can be effective for chronic constipation. Useful when the patient becomes frightened easily. Consider for lower rib pain, nausea, vomiting, or for a bitter taste in the mouth. Commonly used with liver 3. Thank you for your attention.
Let's discuss the ZANZHU ghost point, REN24 Qiang container of fluids. Location on the anterior midline below the lower lip in the mentolabial groove. How to find? On the chin, locate the mentolabial groove, which forms a horizontal depression at the transition from the chin to the lower lip. Locate REN24 in this groove on the midline. Needling 0.2 to 0.3 tune obliquely in a superior direction. Actions indications: eliminate external wind, opens the loop connecting vessels, alleviates pain and swellings, regulates the REN-MI. A Sun-Si-Miao ghost point for epilepsy and mania. Special features: meeting point with Du-Mai, stomach, and large intestine channels. Sun-Si-Miao ghost point, important local point. Extinguishes interior wind, hemiplegia, deviation of mouth, lockjaw, epilepsy, tetany. Removes obstruction from the channel in the face, in pain and numbness of the face, swelling of the face, toothache, gum pain, sudden loss of voice, purple lips. REN24 is mostly used in a local point for wind invading the face and causing facial paralysis. It is used for paralysis of the mouth. Its indication clearly reflects the pathway of the directing vessel of the face, circling around the mouth and reaching the eyes. REN24 was included under its alternative name, Ghost Market, by Sun-Si-Miao among his 13 ghost points for the treatment of epilepsy and mania depression. This is the last point of REN-MI, but the pathway flows on to merge with Du-Mai on the face, so REN and Du-Mai starts together in the depths. Take different routes from REN1 and join together again here at a different level. They make a circuit which at the deep and fundamental level regulates yin and yang within the body, mind, and spirit, and helps direct the life of the individual from the level of their origin through the maintenance and responsibility of their life to the level of expression of the spirits. The constant interplay between the nourishing yin, blood, and the spirit is the expression of life. So many references to fluids, sauce, saliva, and pool in the alternative names resonate with its quenching and revitalizing of the body, mind, and spirit. REN24 encourages fluidity of body, mind, and spirit. When the person's spirit feels wrung out, totally jaded, when agitation and anxiety are rampant, and the natural patterning of yin and yang cycles within the body have gone awry. Receiving fluid can soothe and regulate, used when the spirit is parched and wanting to be deeply refreshed, as well as needing security and order. REN24 is one of the 13 ghost points, as suggested by Sun-Si-Miao. Yang means stomach and large intestine, which crosses here with REN and Du-Mai, is prone to disharmonies to do with heat in the blood and phlegm, which can give rise to mania and severe disturbance of the Shen. REN24 can be used to calm such situation. Yang mean being rich in blood and qi, as well as crossing here and REN and Du-Mai with all the regulation of yin and yang, qi, and blood. Also provides a rich contribution to the environment necessary for the spirit to reside in the heart. To be present and have clarity of consciousness, there must be sufficient blood and essence for heart to feel secure and peaceful. The connection with Du-Mai helps it expel exterior wind. Local point for wind invasion of the face and mouth causing facial paralysis. Local point for neck pain. As a crossing point with Yang means stomach and large intestine, which aside from being rich in qi and blood, has a major role to play in affecting the face. It is frequently used in Bell's palsy, facial paralysis from deficiency or pathogenic attack. Receiving fluid plays a part in regulating the fluid in the mouth and which pass through the throat, appropriate for hypersalivation, dry mouth, and extreme thirst. Being the last point of REN-MI, it will affect the opposite end of the vessel. Its application are a reminder of some of the preoccupation of REN-MI in the lower and middle jaw with yin accumulation and masses, where there has been an over-concentration of yin leading to stagnation. Exit point, crossing point of REN-MI, Du-Mai, LI and stomach ghost point. Here, within the mouth, the connection with Lumai is made, thus linking the yin and the yang. This is where the tip of the tongue touches the roof of the mouth and from which an inner secretion, the precious fluid, can be experienced. This fluid cleanses, baths, and washes away impurities. Can be helpful for hypo or hypersalivation. Lack of coordination is a key factor here. In any part of the body or mind, consider in cases of dampness and insanity, fear, and anxiety can be effective for facial paralysis resulting from stroke or in cases of Bell's palsy. Thank you for your attention.
Now let's discuss the yin deficiency pattern of constipation. Clinical manifestations: dry stools, thirst with desire to sip water, dry mouth and throat, especially in the evening, sore back and knees, dizziness, tinnitus, night sweating. Tongue is without coating and with cracks, pulse floating empty. This condition is very frequent in elderly people with kidney yin deficiency. The tongue in advanced cases will completely lack coating. In less serious cases, it may only partially lack coating or have a rootless coating. And in still milder cases, it may have a normal color with a dry rootless coating. If there is empty heat, the tongue will also be red. Treatment principle: nourish yin, tonify the kidneys, and moisten the intestines. Points: stomach 36, spleen 6, REN4, kidney 3, kidney 6, bladder 23, bladder 25, spleen 15, all with reinforcing method. No mock-up. Stomach 34 and spleen 6 nourish stomach yin. Stomach 36 also promotes the bowel movement. REN4, kidney 3, and kidney 6 nourish kidney yin. Kidney 6 also promotes the bowel movement. Bladder 23 tonifies the kidneys. Bladder 25 and spleen 15 promote the bowel movement. Internal cold in the intestines can derive either from an invasion of external cold or from yang deficiency, particularly of the spleen and or kidneys. Cold contracts the muscles and prevents the proper movement and transformation of qi in the intestines. It can therefore cause constipation. If it derives from yang deficiency, then constipation results not only from the contracting action of cold, but also from the deficient yang qi being unable to push the stools through the intestines. In such cases, the condition is characterized by a combination of deficiency and excess. Constipation from cold is nearly always accompanied by quite severe abdominal pain. Thank you very much for your attention.